Now, after dealing with the shoulder region, the one of the very important region in whole of the upper limb is the understanding of the brachial plexus. Because brachial plexus is the mother of all the things. And if you are not done with brachial plexus, trust me, I can assure you, you will be losing straight away. Minimum, not less than 40-50 marks in your exam. This much is being contributed by the brachial plexus, because you'll have so many stations in OSPI exam, and those stations will be targeting the nerve supplies and function of these muscles. And if you are not good with the nerve supplies, and if you are not able to, because our questions are not like this, name the branches from the lateral cord. Nobody cares for that. That era is gone. We'll test you different ways. Right? So be very good with, because brachial plexus, if you are not good with that, trust me, you must be having major hiccup. If you think you are not done with that, don't come for the exam. Send a medical application that I'm sick. This is really an advice. So I'll be starting with axilla. And then brachial plexus is one of the content of the axilla. So now, to start my ball rolling, I have this skeleton in front of you. Now my first question is, what is axilla? What do you understand by the term axilla? The answer is armpit. How many says armpit? Raise your hands. So there are a big number of people, they are saying axilla is armpit. Is there anybody who differs with them? Anybody who disagree with that? No, you said I agree, then you say I disagree. So what?
No, I mean the response is not exactly the armpit. It's not only the armpit. It's like a little bit of an area, just the contained in the armpit, and a little bit going down.
Okay, now let's, Muhammad, thank you. Now let's talk about what is armpit. What is armpit? You will be saying axilla. This is what you're saying. Now, let me tell you, armpit is what? The place where now you see some hairs are growing. That skin, that place is given the name of armpit. That's it. It's not axilla. It's not axilla. Okay, then anybody can try now. What is axilla? Hello, my dear. You are sleepy. Before you are putting cap on someone's mouth. I saw that when you're doing there. Were you not doing this? You did this before? 5 minutes before. You are sitting there in that seat. Oh, I was watching you. So, Osama.
It is the space between the arm and the thoracic and that actually represents the upper arm.
It's like a connection, a canal between the cervical part and the upper limb.
It's the root for some nerve and the artery, which is on armpit.
Okay. Now, I differ with this information to little bit, not wholly. I say axilla is a potential space. Now, can anybody explain here what is a potential space and what is a real space? Talal, what do you think? Look, I'm not saying if I deny for you, doesn't mean that you're not right. You're right, but I want to hear some real words from your mouth. You were saying something, you said it, like you did it, huh? Mohsen, what do you think? Mohammed, khalas, I'll tell him, don't tell him, huh? He minds from you, huh? Mohsen, what do you think? Real place where I live and potential place where you live. Is that?
And it doesn't change.
Two structures. If I say four structure, then what do you call it then? I can hear someone is... Siri, you have some answer? Yeah, you.
Potential space would be space when the muscle is either contracted and space builds up like...
You are more close. Look, this room is what? Is a space or a potential space? Is a space. Good. I like it. Is a space. So if I have a mechanism, I press a button and these walls and the roof disappears. But you will still call it a space? Then it will become a potential space. So now my hand is like this. This is axilla. My axilla is here. I do this. I don't know where is my axilla gone. It's gone. There is no axilla now. So axilla is a potential space which is pyramid shape in structure. I hope everybody knows what is a pyramid. If you don't know, this summer go to Egypt, see what are pyramids. Now, this space, very nicely said, it transmits structures from the neck, from the thoracic cavity to the upper extremity, to the upper limb, or structures from the upper extremity to the neck or to the thoracic cavity. So it's a two-way place where things are going and coming. Is that right?
Yeah.
So now when we talk of a space and we say that it is a space as well as a potential space, it is there and it can be disappearing by doing something. So let's develop it, let's see it. People were talking here, there are little bit boundaries. You mentioned something about armpit which has a little value. You are not wrong absolutely, but you had a little bit misunderstanding with the play of the words. So this box, this yellowish thing which I have drawn here, this area is making the base of my axilla, and that is being made by skin of the armpit. This is the pit of the arm, the skin of the armpit and the fascia. So this we call as the floor of the, and axillary fascia and skin of the armpit are the one who makes the base of my axilla. We know that it's a pyramid shaped structure. Everybody knows how a pyramid look like. So on top there is a small box here. Can you see that? And that is the place where I have the apex. I call it apex. And now collectively, functionally, we are wise to say it's a cervico-axillary canal, a passage which transmits cervical structures to the axilla, part of my upper limb. Am I right by saying that? Are you with me? Yes or no?
Yes.
So now let's construct its boundaries. This brown thing, which boundary is this? Osama, what you saying? What thoracic? Say medial wall, that's it. And who makes it? Can you see serratus anterior here? What do you see here? Rib cage. So why are you saying pectoral? So medial wall, who makes it? Upper ribs and serratus anterior. Ribs were visible, serratus anterior was not visible. When I'll be making the boundaries, I'll be talking about the contents. There are more and more. I'll be talking main and majors. I'll not be talking about minors. So don't get me, oh, he didn't mention that. But I don't want to make it complex. First build it, then keep on adding things. So now you are clear with this is the medial wall because it's present medially, and who makes it. And then this blue thing is my lateral wall, and who makes it? Upper part of the humerus and the structure which are attached to that humerus. How they do it, we'll explore it shortly. Now this green, posterior wall, who makes it? Scapula, and a muscle which lives on that surface of the scapula, that was my subscapularis. Is it fine? Perfect. Usually when I make my presentation, I try to match the things. How? Any structure, the color which I use for making, I try to put it with that color. Because I don't put lines here, it will distort the whole thing. So once you are looking into this in a PDF format, you can match this color to this color. Where it goes, it means it's all about that.
What about the wall that's on this side?
This one?
The one that's.
My dear, there's a color. Which wall? Which one is perpendicular? This one? This one? Perpendicular to the green one.
In front of the.
I have not made it yet.
Yeah.
It's not emerged yet. Sabr. Wait. So, can you see it now? What you're asking, it has come now. You have not seen it because you're busy. Look at it. Now, if I give it some darker color, my posterior structure could have been invisible. And PDF, you cannot see anything. So to make it little bit, that's why it's important when you are in my sessions, you have to be having full attention on the screen. Because this version will not be available to you. So, this is my anterior wall. And my anterior wall, again, is a light shade of brown. And that is made by pec major and pec minor. And some fascias. Clear? So if somebody asks you, what are the boundaries of the axilla? Now simply you can figure out yourself. You have a 3D picture. You should have a 3D picture in your mind. Clear? Now the apex, as I said, is directed towards the neck, towards the thoracic cavity, and this is towards the upper limb. Clear? Now, I want to see what is inside this pyramid. Who lives inside? Yes.
But before that, can I please ask you?
Yeah, ask me.
The borders and the limitations to these, to this cavity, but because like that's why you said it's a potential.
Yeah.
So these like boundaries will be disappeared whenever you move.
Yeah.
What does that mean?
Come here.
According to
I love your. Come. I wanted a volunteer. You invited yourself. Stand. Now he is standing. Everybody can see him. Don't mind.
Yeah.
I'm not pinching you. Okay. Guys, can you see that? And you have all this with you. Can you see that this is the anterior wall? And who makes it? Pec major and minor. And on the back, I'm holding what? Some part of the serratus anterior. No, not serratus anterior. Who's there? Subscapularis. And there is another guy that will be coming. So that muscle layer is there.
Teres major.
Obviously.
Yeah.
So they are there. Can you feel yourself in your own body? Posteriorly there is a fold. Is there a fold? Is there a fold here? Here?
Yes, yes.
You can feel your folds? So these are the anterior walls and posterior walls. Is that right?
Yes.
Now, this is the medial side. Can you palpate your serratus anterior muscle here? This is your serratus anterior muscle. Now, what Muhammad was asking, how it become a potential space. Gentlemen, can you stop playing with your mobile? Is it iPhone 10? which makes you so excited? Now this is the axilla. This is the space. Now Muhammad, what happens? Show me where. Now feel your folds where they have gone.
Yeah, they're still.
No, but are they in their place? All of them move away. Got it now?
Yeah.
They have all moved away. So the walls, the structure which was there, they all moved. So I said to you, if I press a button, if all these walls and the roof go away, and then we all are sitting in an open space. So axilla is gone. Got it now?
Yeah.
Thank you. Clear to everybody? So what we mean by saying is a space and a potential space. Once arm is by the side of the body, axilla is very much there. Once you abducted, hyperabducted, you can feel this. Obviously this muscle is not going away. But the place, the way it was there, now it is no more there. It has been shifted. Like if I can put the walls by some mechanism, we lift the shutters, all shutter will disappear. That factor is there, but now it's no more working that way. It has been changed. Clear? So, are we set with this so far? Now I want to see who's inside. Like this room, who is the content? We all. Plus this furniture, carpet, this camera, these lights, these devices. We all are the contents. So, I like to cut it from point A to point A. And after cutting that, how it is visible to me? Yeah, no problem. Answer it. I have no problem. If it's that important, do it. Otherwise, delete it. Is it clear?
Yes.
So now, we are looking at different structure because it's a cut section. And what we are looking at, this is the anterior part, this is the posterior part, that is the lateral part, this is the medial part. Towards me is medial, away from me is lateral, in front of me is anterior, behind me is posterior. So what are these? We are looking at sternum. Sternum comes anteriorly, head of the humerus goes laterally, scapula comes behind, and the ribs are medially. Is it clear? If you look at the head of the humerus, this is a section, Muhammad. So there you can see there's a dip here, and there are two elevated areas. So this dip is known as intertubercular sulcus or bicipital groove. And this is the lateral lip and this is the medial lip of intertubercular sulcus. Am I right in saying that? So we learn that. Now coming to this picture again, anteriorly I have my pec major, which is coming from sternum. We know that it comes from but in this section you cannot see the whole pectoralis major, one slice of that. So it seems it's coming from the sternum and it's going to the lateral lip of the bicipital groove. Is that right?
Yes.
So we said that the anterior boundary is made by pec major. Then the next word was pec minor. There you have it. Is it fine? So we are making it now. Medially we learned that rib and the serratus anterior. Fine? Posteriorly, we talk about scapula and subscapularis. Muhammad mentioned another muscle which is there, and that is my teres major, which goes to the medial lip of the bicipital groove. Teres major. Is that fine? Going further, I have another muscle which goes and present in this bicipital groove. Who is that? Somebody said biceps? Latissimus dorsi. So that makes a lady between two majors, L between two M's. Easy to remember. So I have these muscles are present in this situation. Is it clear? Going further, I have some more muscles which are coming here, and here I have biceps. Which part of the biceps brachia you are looking at? Long head, and this one is the short head of the biceps. And then I have another muscle, coracobrachialis. Is it fine? So, but we will not talk on these muscles in a big way. Is it clear so far? Can you see this place is white? You all agree to this? Remember this point. So now I'll be putting up the contents. So who are the contents? I have something which is red and has a lumen. So there is an artery. This region is axilla. So everything starts with the word axilla. So axilla, artery in axilla, we'll call it axillary artery. Vein in axilla, we call it axillary vein. Some other things, they all start with axillary. So I have axillary artery, and now there is a vein. What name to be given to it? Perfect. Then I had brachial plexus. Now brachial plexus is a very broad term. Part of the brachial plexus, we cut at a certain level. So little bit part of the brachial plexus which is existing in the region of the axilla. So it means I should be encountered with the cords of the brachial plexus. So I have one laterally, I call it lateral cord. One medially, I call it medial cord. And one posteriorly, I call it posterior cord. How these cords have been made, we'll be talking it shortly. Clear? Now all this is being wrapped in a fascia. Like you are setting your room. You put your devices. You put your sound system. You put your Xbox. You put your other things, your computer and everything. So many wires going from your table. So you bring one wrap, one cover which has been available, and you put around these wires. So they all go in one cover, one sleeve. So it looks nice, and they are been more organized. They are not moving right and left. These all structures, nerves, arteries and veins, they are called neurovascular bundle. These are the neurovascular bundle. So this neurovascular bundle is being enclosed in a wrap, in a sheet, and this sheet is a fascial sheet. So we call it axillary fascia. Axillary sheet which is made by this axillary fascia. Is that clear? Now, We all know that this space is white. Now, before that, you can see that from the lateral cord, I have lateral pectoral nerve, and which is seams supplying my major and minor. From the medial cord, I had medial pectoral nerve, and which is supplying major and minor. Now, this space is no more white; it is filled by something. Why is that, and what is that?
It's not only fat, it's fat and lubricating fluids to ease in the friction between muscles.
What muscles?
There are so many.
What muscle?
Fat.
No, but they don't need it. They don't need any fat.
No, not fat. I'm saying lubricating.
You don't need that. Guys, why we have this fat? Because you buy something, some electronics device. When you open the box, there is a packing inside. So you want, foam. So you want nothing to be moving inside. Everything should stay where it has to be. If you have a delicate thing, I'm not asking you bring a sack of something, or you're bringing but something very expensive and very delicate. It should come in a very specific box, and that is being designed to accommodate everything. Somebody want to say something? Because your head is like this. So this fat is something which is there to give protection. And we call it, this fat is in the axilla, we call it axillary fat. Now, there are certain more structures. These are oval beads which are there. They are brownish in color. Normal life they are not brownish. They are known as axillary lymph nodes because they are present in the axilla. Guys, these lymph nodes are very important for us to know. What do you think? Why it's important to know about the lymph nodes? Yes? Breast cancer only? Everybody has breast cancer? You, me, everybody?
To detect infection.
To detect infection, like doctor put his thermometer inside and get...
They enlarge.
Hyperthyroidism, wow. What else?
They're easy to palpate.
They're easy to palpate. You're poking someone's... Okay.
They can become enlarged with compressing the brachial nerves.
I was asking how they are useful for us.
The lymph to the heart, the fluid that can escape from the circulation.
Lymph from where to where?
From the tissues back to the circulation.
Okay. So how they are useful to us?
Prevent edema.
Prevent edema. Tell me answer. I'm asking you. No, behind you. Osama has Googled it so far.
No, I didn't go.
Okay.
Since we have blood exchanging, so some of the fluid should get out. So when it's going to take it in, and take it back to the heart.
Now they say loud. Gentlemen, hello. I know you're busy in your toy. What are you doing? No, it's a toy again. Because what I'm saying something to you and you're not listening to me. What do you think? What is the answer and what is the question? What's going on here in this class? Huh? You're not playing, I know. But what was the question? What's going on in the class? Are you here in the class? Are you with us? No? Something else? So what we are talking here at the moment? Huh? You don't know. Then either if you are sitting in this class, if you are waiting for attendance, I'll mark it. Then you can go. I have no problem. If you are here in this class and if you are not focused what's going on, then it's better stay outside. Do something more fruitful, more useful. If you are here, be part of us. Huh? What do you think? What we are talking? What same thing? I don't know what he said. I forgot.
It's only for, to indicate the infections and metastasis and it's preventable.
You have no issue. No problem. Infiltrate the... Your answers are not bad. You are trying. But I want you, maybe someone answer a better option. Najmuddin.
Guessing because most of the lymph that comes from the head goes to the maxillary.
Middle of the upper limb.
Umar. You're Umar or not?
I am safe.
Safe, yes.
I think the digesting cells or like so.
No. Hello. Guys, now you have the Noshad. Would you want to say something?
Production and the preservation of the
Muhammad.
Everything that comes from the upper limb would go directly to the subscapular.
Osama, I saw your hand. You're tall enough. Don't show it. I can see that. Even if you put a finger, it's visible. These are working.
So everything that comes through the lymph from like the upper limb goes to the heart from there. So
This already been said by him.
yeah.
Maybe 5 minutes before. If you're coming up with a new idea, come with an original and a new idea. Yes, Osama, you have something? He said the same answer.
In this region we have...
No, fine. Now, lymph nodes, as you were saying, these are functions. Agree. I'm not disagreeing with any one of you. Everybody's right. But my question was, that's what's the biggest problem. We put some questions in our exams and people write answers according to what they think. But actually, we need an answer according to what we think. And if your thinking and our thinking is matching, you are getting A's. And if it's not matching, you are getting C's. That's the problem. And you should be able to read out what is being the target. So if you are target oriented, then there is no problem. And the whole approach of this learning, otherwise I can send you all this, you can do it yourself without discussion, there is no benefit. The benefit is, I don't come and I don't deliver a speech here. My objective is, let everybody on the board, I want to involve every person. I'm picking on you guys, not for any purpose. My idea is to pick on you guys so everybody can participate. Everybody can have a role in the development of what we are learning today. So these lymph nodes, they are very important. In what sense? Other functions have been mentioned, but one of the main function, someone has to be labeled as he is having cancer of some organ of the body. Now, the second question of the patient and the family is, how long I gonna live? How much is my leftover life is? Am I living for a month, for a week, for a year, for 10 years, for 5 years, for 20 years, or for whatsoever is remaining? That is a concern, that is a question. That's why we are scared, because we are scared from the death. So now, doctor has no magic. Doctor cannot bring these information right from he has a ball and he can see in that, okay, your life is finishing this date and this time. So doctor is doing what? He'll do a workup. And what he's targeting in his workup regarding this cancer is status of these lymph nodes. If the disease has infiltrated the lymph nodes, it means the disease has moved outwards. The disease has moved outwards. Now, they say you have grade 1 disease, you have grade 2 disease, you have grade 3 disease, you have grade 4 disease, grade 5 disease is in the grave. So now, some people are offered what? Surgery. Some people are offered radiotherapy. Some people are offered for chemotherapy. Why this is the option? It basically comes, the information comes to the doctor who's treating that cancer patient is the status of the lymph node, the involvement of other organs. Is this disease is confined to this part or it has moved, like someone has a cancer which originates from the kidney. If it has moved to the bone, certainly this person may walking and he can break his bones. Because the cancer cells has infiltrated his bones and he can have fractures. These are pathological fracture. You have nothing, no trauma, and suddenly you just wake up and tuck, you break your bone from 3 places. And if you look at it, what is happening, what's wrong. You go in that bone part, you take a tissue, you look for the culture, oh, these are the renal cells. What renal cells are doing? You look for the kidney, oh, kidney has a mass, kidney has a tumor. So this tumor has moved there, that we call as metastasis. So these lymph nodes are one of the major barrier which are used through which the cancers has been spreading. So when we look at these lymph nodes, someone has an enlarged lymph node, visited his physician look at that. If he is more suspicious, he asks for a biopsy, he asks for further evaluation because he wants to rule out, is there something cooking inside and you don't know what is happening. These lymph nodes which are palpable to you, maybe someone of you, if you have throat infection, they can be palpable. If you have some dental problem, they can be palpable. So they are palpable as a result of infections, they are palpable in presence of cancers. So to distinguish in between, is it a cancer disease or is a non-cancer disease? Cancer disease we call it a malignant disease, and non-cancer disease we call it as a benign disease. So these lymph nodes are helpful in that regard. Is it fine? So these lymph nodes are helpful in grading a cancer. So this is the magic of that doctor who tells you you are not living more than 5 months and you are not living more than 10 years. Is it clear? So these lymph nodes, as they were in axilla, we call them axillary lymph nodes. Now these lymph nodes, there are further details for them. They are placed in groups, and they are, according to their position, they are apical, they are lateral, they are medial, they are vice versa. And if you enter in the treatment of a cancer in a time, you can prevent. I can quote someone to you who is very successful in his life. We all wait for him. He's a big legend of this world. He's a very rich person, very famous. Everybody, if you get a chance, you want to get a selfie with him. And that person is Tom Cruise. You have a value for Tom Cruise or no? No? You don't watch his movies? Muhammad? You hate him? Why?
He's not a good actor.
Really? They are mad, they're giving him Oscars and all that. So, but majority likes him. Majority wants to go for his movies. Right? So, but he has a cancer. He had a cancer in his testis, and that cancer was treated in time, and see, he's living a successful life. His movies are making high businesses in this world, and there are a big number of people who want to who likes him and who go with him. Right? So cancer, if you treat in time, if you have that window period, then you can be having a success story. And if you delay it, if you think things gonna do fine after some time on their own, then probably you are mistaken and you will not be getting to the clues. Is that right? Can you wake him up? You are thinking your camera is working, so you have to sleep. It's a nap time. Good. I like it. Now, you are looking at how the axilla is being seen in a human body, inside, alongside with the skeleton, and then it's showing its contents. Is that clear? Now again the boundaries. Now, I start now with the contents of the axilla, and one of the major content is the brachial plexus. And in making of brachial plexus, we need to understand, I'm just doing a revision here for the nervous system of our body, and for that you have taken already 2 lectures in your foundation block where you are taught regarding these informations, the different sets of nervous system, and I understand you have learned about the peripheral nerves, and you have learned about the central nerves, and you know it, what is a spinal nerve and what is a cranial nerve. Gentlemen, can you tell me, I know you're busy with your iPad or your laptop, what is the difference between peripheral nerves like a spinal nerve and a cranial nerve? What is in the cranium? Who lives in the cranium? Brain. And spinal nerves? Vertebral column. Who lives in the vertebral column? Spinal cord. Right? So those nerves who are emerging from one place to other place. Now, let's say, for example, you are standing. Suddenly, you start looking downwards. What happened? Why are you doing that? Maybe some cat or a dog went by your leg and rubs his body with your leg. So this information is being brought to your brain. You have a center in the brain where you get the information, you synthesize them, what you see, what you hear, and what you feel. So you cannot see it, something has rubbed your legs, but you get an information, something has rubbed against my leg, something soft. Now your brain starts integrating what to do. Order comes. So this whatsoever has gone is the sensory input. It has reached to your brain, to the sensory center. Now brain start thinking, synthesizing what to be the next. Okay, look for it. How to look for it? Move your eyes. It's not visible because it was backward and laterally. So body has been designed, the muscle has been ordered, move it. Neck has been ordered, eyes has been ordered, there are muscles, their nerves have been ordered. So everything is working synchronously. So you are looking down. Oh, it's a cat, fine. Oh, it's a dog. But then you are distinguishing, is it a wild cat or is it a domestic cat? Is it your own dog or is someone's dog which is about to eat your leg? So, and if it's a stray dog, then you are thinking, oh, what should I do? Save it, protect yourself. So this action which is being brought about after having this sensation, that's the motor activity. So we need to have a motor activity and we need to have a sensory activity. So every spinal nerve must have these two characteristics along with having some other characteristics. So now this is a section of a spinal cord at any level. And be reminded, spinal cord does not present below the L1 vertebrae. First lumbar vertebrae, spinal cord finishes here. We have 31 pairs of spinal nerve. They are going for the lower segment, but at the L1 level, all the nerves emerge out from the spinal cord and they run separately. But in the upper segment, each segment they get out of the spinal cord. So, in this picture, can you see something is grey and something is white? So this grey is called grey matter and this white is called white matter. In the brain, if you cut a section of a brain, this white is replaced by the grey and this grey is replaced by the white. So it's reverse. In the brain, outer cover is grey matter and inner cover is white matter. And here is vice versa. And this grey matter here, it is very thickly populated. And if you see by some other studies, you can see there are so many complex fibers which are running longitudinally. They are crossing over each other. And this is a very busy station, like you have a very high frequency traffic which is going on here. And these are the impression made by those which are traveling in this area. It has an anterior part. Why I'm saying anterior? Because this is anterior. It has a posterior part because opposite to anterior there must be a posterior. Is that right? But when we talk of the nervous system, we don't use the term anterior, we call it ventral. And we don't call it posterior, we call it dorsal. Am I right? Is it clear? So now, white matter and grey matter, we said it. And this red circle is the place where I have the motor fibers, the cell bodies, the neurons, motor neurons, their cell bodies are living in this region. Right? So this is the place where we have cell bodies of motor neurons. Clear? So automatically when we have, and this place is known as the anterior horn or the ventral horn of the, so ventral horn, this one is the ventral horn and this one is the root. And this whole activity is occurring within the vertebral canal, within the vertebrae. And from this place, they emerge from an opening which is visible on the sides known as intervertebral foramina. And this whole nerve is being made inside the vertebral canal. So this is my motor fibers which is coming forward and it's originating from the motor neuron cell body, and my motor fibers, they are coming from the brain all the way down. we cut a section and we see it here as a rounded thing, but it's a long cable which runs from the brain to the lower part of the spinal cord. Same goes for the spinal thing. Some places they cross over from this side to that side, this side to that side, but they are continuous columns. Is it clear? There I have, now this place, my sensory thing does not live here. I have my sensory fibers here, but the neuron, sensory neuron cell body is placed in this area which was given the name of dorsal root ganglion. This is my ventral root, this is my dorsal root. And in this place I have the neuron for the sensory. Sensory neuron cell body is here. And it is connected with the sensory area in the posterior horn or the, what other name I can give to this? Dorsal horn. Wake up alarm. And finish it. Is it clear now? From the sensory area, from this sensory neuron, from this motor neuron, we have sensory information are going, motor informations are coming. And they all are gathering at this place where they are making a spinal nerve. So this thing in the circle is a spinal nerve. And at this place it emerges out of the intervertebral foramina. Is it clear?
Why isn't it called a root?
Because it's like a root.